They won't tell you this at your regular doctor's visit, but let me be blunt. If you've stopped masturbating in your later years, your body might already be breaking down, and you probably don't even know it. No, this isn't some taboo topic or locker room nonsense. This is real, clinical, physiological truth. Consequences of ignoring this reality can be devastating, not just to your sexual health but to your brain, heart, sleep, immune system, and even your sense of self. My name is Dr. Sara Husnain, and I'm a urologist and men's health specialist with over 30 years of experience working with aging patients across the country. I've spent my career studying how the body changes as we grow older, especially regarding intimacy, hormones, and long-term vitality. And one of the biggest silent threats I've seen is this: too many older adults abandon their sexual health and with it, a major key to their overall well-being. Here's what may surprise you. Masturbation isn't just a leftover impulse from your younger years. It's actually one of the most powerful tools your aging body still has to regulate your hormones, boost your brain, protect your prostate, and even fight off depression. If you've stopped or never started, the price you're paying might be far higher than you think. In the next few moments, I'm going to walk you through exactly what happens inside your body when you stop masturbating in old age, and what I share may completely change how you look at your health and yourself from this moment forward. Before we get started, if you care about staying sharp, healthy, and independent as you age, go ahead and subscribe and turn on the bell so you never miss important advice tailored just for you. If this message resonates with you, type 1 in the comments. If not, type 0. Your feedback helps me create content that truly supports your health and well-being. Now, let's begin with the first and perhaps most overlooked consequence of not masturbating in old age: what it quietly does to your prostate and urinary health. 1. Decreased prostate health and urinary function. When I first began practicing urology over 3 decades ago, I didn't expect so many of my patients to open up about something so private yet so critical to their health: the quiet disappearance of sexual habits in their later years. One man I remember clearly sat across from me and said, "Doc, I just figured I didn't need that part of life anymore." He was in his early 70s, fit, sharp, but he had been waking up 4 or 5 times a night just to use the bathroom, and he couldn't understand why. What he didn't know, and what most men don't realize, is that regular ejaculation, even through masturbation, plays a crucial role in keeping the prostate functioning properly. Prostate is not just a passive gland sitting in the body. It's a living, dynamic organ. Produces fluid, expands, and contracts, and like any system, it suffers when neglected. Without regular stimulation and release, prostate fluid can stagnate, creating an environment for inflammation and swelling. This can disrupt everything from urination to sexual performance. You might feel it as a heavier bladder, weaker stream, or an uncomfortable sense of fullness that won't go away. These aren't just annoyances, they are early warnings. Chronic prostate congestion can escalate into more serious conditions like benign prostatic hyperplasia, BPH, affecting nearly 50% of men over 60. Left unchecked, it can lead to urinary retention, bladder infections, and even the need for catheterization. In fact, studies have shown that men who ejaculate 21 times or more a month are significantly less likely to develop prostate cancer than those who don't. So let me be very clear, we are not talking about a return to youth or some kind of obsessive behavior. This isn't about fantasy, it's about function, using your biology to protect your body in the simplest, most natural way possible. When you stop masturbating in old age, you're not just ignoring pleasure, you're risking pain, inflammation, and a gradual loss of control over one of the most basic human functions: urination. 2. Cognitive fog and reduced mental clarity. Not long ago, a patient in his late 60s came to see me. He wasn't complaining about his prostate or energy levels. He just said something that struck me. "Doc, I don't feel like myself anymore. I walk into a room and forget why I'm there. I lose my train of thought mid-sentence. I used to be so sharp. Is this just old age?" Yes, aging naturally brings some cognitive changes, but what most people, even highly educated, health-conscious adults, don't know is that sexual activity, including masturbation, plays a powerful role in protecting brain function. Here's what happens when you engage in self-pleasure. Your brain releases a cocktail of neurochemicals: dopamine, serotonin, oxytocin, all of which are directly linked to memory, focus, and emotional regulation. These chemicals help build and protect neural connections, stimulate blood flow to the brain, and reduce cortisol, the stress hormone that damages brain cells. When you stop masturbating, especially over a long period, those natural brain protective chemical surges become less frequent. Over time, this can dull your mental edge. You may find it harder to concentrate, process information, or even feel motivated. It doesn't happen overnight, it sneaks in slowly. First, you forget names, then you forget what day it is, then you start to doubt your mind entirely. In men, there's an added hormonal shift. Testosterone, the hormone tied to memory, decisiveness, and vitality, can decline faster when sexual activity drops to near zero. Some studies have linked reduced sexual activity in older adults to early signs of cognitive decline or even dementia. Point 3. Heightened depression and emotional numbness. A patient in his early 70s, a widower, came to me not for a physical ailment but for something he couldn't quite explain. He said, "I don't feel anything anymore. Not sadness, not joy. Just flat." He thought it was normal for his age, but this emotional numbness, often masked as part of aging, may have a deeper cause. The loss of sexual stimulation. Masturbation is not just a physical act, it's an emotional release. During climax, your brain releases powerful chemicals like oxytocin and endorphins, natural mood stabilizers that combat anxiety, tension, and low mood. When you stop engaging in this act, you risk becoming emotionally numb. That numbness can eventually lead to depression. 4. Poorer sleep quality. I remember a man in his late 60s who came to me after months of poor sleep. Despite having no major health issues, he was exhausted all the time. When I asked him about his intimate life, he admitted he hadn't touched himself in years. What many people don't realize is that orgasm plays a significant role in helping your body enter deep, restorative sleep. Orgasm releases chemicals that help regulate your nervous system and promote sleep. When you stop masturbating, this natural trigger for deep sleep vanishes, leading to poor, fragmented sleep. 5. Weaken pelvic floor and blood circulation. Pelvic floor muscles play a crucial role in supporting your bladder, bowel, and sexual organs. Regular sexual stimulation, including masturbation, keeps these muscles active. Without it, these muscles begin to weaken, leading to issues like urinary leakage, difficulty standing, and even erectile dysfunction. 6. Lower immune function. One of the lesser-known benefits of sexual activity, including masturbation, is its impact on the immune system. During orgasm, your body releases immune-enhancing agents like immunoglobulin A, IgA, and endorphins. These help defend your body against illness. When you stop masturbating, your immune system can weaken, leaving you more susceptible to colds and infections. 7. Loss of body ownership and self-worth. A retired school principal in his late 70s once told me, "I don't really feel like I live in this body anymore." He had stopped engaging in self-intimacy, and the result was a deep sense of disconnection from his own body. This disconnection can erode your self-worth, making you feel like a stranger to yourself. Final thoughts. Reclaiming intimacy, reclaiming health. When you stop caring for your sexual self, a chain of quiet consequences begins. From prostate health and brain function to emotional well-being, sleep, immune function, and even your sense of identity, neglecting this aspect of yourself can lead to irreversible damage. But it doesn't have to be this way. Reclaiming self-intimacy isn't just about pleasure. It's about preserving your health, your vitality, and your connection to your body. If this message resonated with you, don't keep it to yourself. Share it with someone who might need to hear it, and leave a comment below to let me know your thoughts. Your voice matters, and your story might help someone else feel seen.